Right. So for the next motto issue, related concept we should be talking about is what is usually abbreviated as what? GMFCS. GMFCS. So for the GMFCS, it's fully known as what? Gross Motor Function Classification System. Gross Motor Function Classification System. All right. So it's just a 5-level tool. It's used to describe and categorize the movement abilities with individuals that have what? Cerebral palsy, especially children. So a child has cerebral palsy, can they be able to carry a load up and upstairs, or the stage 2? Can they be able to move on their own? Do you understand? You're just trying to look at, okay, how is the individual still maintaining their movement even as they have cerebral palsy? All right. So it's focused on self-initiated movements like what? Can they be able to sit? Can they be able to walk? All right. Or are they using mobility aids? All right. And which type of mobility aids? All right. Helping clinicians, families, educators. All right. So it will now help the clinicians, family, and educators to understand what, the child's functional mobility. All right. And this can also help you plan, know the degree at which this cerebral palsy has affected such a child. Okay. So for the level 1, this is what we got here. Or should we be moving like this? Yes. So point out level 1. So level 1, we said that what? The child can walk without limitations, but may have reduced speed, all right, have problems with balance or coordination, but it's not that much. Level 2, the child walks with limitation, like here. Can you see that the child has to like hold, the staircase stuff to basically be able to maintain balance, right? So the person is using railing for stairs, struggles with uneven surface. If the surface is not flat, there's a problem. Level 3, works with assisted devices, may use a wheelchair for long distances. Stage 4, limited self-mobility, primarily uses a wheelchair, alright, may stand with support. Okay. Level 5, severe limitations. So everything that the child is needed to do, it needs what? Assistance. Alright. So this is just age specification classification. All right. So there's also the age component. All right, where the child could be under 2 years, 2 to 4 years. So as you are doing this classification, you have to indicate the age of the person, because sometimes cerebral palsy becomes worse as the person grows up, or it becomes better depending on what the type of treatment the person is receiving. So what we got here is this. The person can be under 2 to 4, 4 to 6, 6 to 12, 12 to 18. All right. So why it matters, it actually helps set realistic goals for therapy and mobility. The type of patient you are dealing with. All right. Guys' decision about assisted technologies. What type of wheelchair to buy. Supports communication among care teams and families. All right. It's also using research and legal cases to document functional impact.